Unfortunately for humans, trauma is a natural part of life. The unpredictability of life is scary, but without hardship, the meaning to our lives arguably becomes less significant. That said, trauma is an important issue to talk about, and it's something that presents itself in many forms, not just in the mind. According to the author of The Body Keeps a Score, our experiences can leave imprints on the body, causing tangible psychological and physiological changes that must be addressed in order to find ourselves again. So how do painful past experiences manifest themselves in our body and mind? Trauma can often leave an individual stuck in the past. They may feel powerless, unable to focus on their present situation and build a happy life. In a simplified way of explaining this, the trauma causes a fragmentation of experiences, with the mind saving the memory differently to normal everyday memories. When remembering these painful experiences, the mind may do a poor job at recognizing the memory as an event that is over. This is why many forms of therapy focus on reassuring the brain that the experience is in the past, that it's ended, and that our lives in the present can continue despite past suffering. Trauma can also lead to other issues, such as dissociation, exhaustion, and confusion. Some people develop physical aches. A common consequence of trauma, however, is stress. We all deal with stress, and a little bit of it can motivate us to make changes in the way we live. In some cases, though, stress can severely impair people's lives. There are real physical changes that occur in the body in response to great stress. Trauma can sensitize the hypothalamic pituitary adrenal axis, the body's central stress response system. A stressor stimulates your hypothalamus to release corticotrophin-releasing hormone, or CRH. CRH binds to the CRH receptors on the anterior pituitary gland, prompting the release of adrenocorticotropic hormone, or ACTH. ACTH then signals your adrenals to produce cortisol. While cortisol is a beneficial hormone in small amounts, extreme activation of this hormone can wreak havoc on our bodies and keep us on edge. Left unaddressed, chronic stress contributes to digestive issues, sleeping problems, and heart disease. Furthermore, trauma can directly lead us to engaging in addictive behaviors, such as excessive drinking as well as smoking. It's safe to say that most people could empathize with anyone dealing with such issues. This leads to the obvious question: how can trauma be treated? The three most common forms of treatment are medication, traditional talk therapy, and connecting with the body. In this video, I'll be focusing on the last two. Let's start with therapy. The type of therapy one engages in depend on their individual problems, experiences, personality, preferences, and a whole range of other factors. Some treatments include cognitive processing therapy, prolonged exposure therapy, and eye movement desensitization and reprocessing, or EMDR. EMDR, for example, consists of a therapist leading a patient through a series of side-to-side eye movements whilst remembering sensitive experiences. This form of treatment has been shown to alleviate emotional distress after trauma. Now, how can you connect with the body in order to relieve trauma? When people are traumatized, they often lack harmony between the body and mind. Some patients may have a hard time distinguishing where their body aches in times of pain, and may feel as if their body isn't their own. Interestingly, Eastern traditions have long relied on movement, mindfulness, and rhythms to self-manage and heal from trauma. Yoga, martial arts, rhythmic drumming, and Tai Chi are all examples of different techniques that help the body look inward as opposed to outward, to really embrace the things that your body is telling you and to learn to self-regulate. To finish off the video, here are a few practical ways you can try to improve emotional regulation, connect with yourself, and simply enhance your mood. Find a mindfulness practice that you enjoy. It can be meditation, prayer, breathwork, yoga, or anything that works for you. This will help you stay in the present and become more aware and accepting of the ideas and chit-chat that your mind presents. Find a movement practice you like. It can be any form of sport or exercise. Of course, as I mentioned, some forms of movement like yoga and Tai Chi have the added bonus of also incorporating mindfulness. Movement provides physical, mental, and emotional benefits. It can clear your head, put you in a flow state, and has positive cognitive effects in the long term. Talk to people you trust. A friend, a family member, a therapist. Talking to people in your life that can truly listen to you without judgment helps us bear the more difficult moments, providing emotional and mental support. If you guys found this interesting, I'm sure you'll enjoy the book, The Body Keeps a Score. I gathered most of my information from it, and I urge you to check it out. As always, thanks for watching, and I'll see you in the next one.